So, question I ask a lot of places, has your office got an AED in it? Now I'm here talking to Kevin from ZOLL, and one thing he knows is what AED stands for, and also why you should have an AED at your premises. So Kevin, can you just explain what we're looking at here?
Sure, yeah. So these are a number of the AEDs that we currently manufacture. AED, just so you know, is Automated External Defibrillator. The challenge that we're faced with is that current survival rates outside of hospital in the UK are around about 6 to 7%. But if you can shock a patient in a sudden cardiac arrest within 3 to 4 minutes of a witness collapse and deliver high quality CPR at the same time, you can massively increase their chances of survival to as high as 60 to 70%. There's also a massive drop off as well, so survival rates will drop from maybe 7 to 10% per minute for every minute you do not deliver the CPR or that you deliver the therapy. So the ambulance service is great a job as they do, and we all know that they're stretched and under-resourced, is their target time is to get you to you within 8 minutes of a witness collapse, by which time your chance of survival is probably less than 10%. And so that's why it's really key to have these situated within the workplace.
So my question would be, really, is this is an investment for some companies.
Yeah.
So what's the kind of whole life or the life cycle they'd be looking at? If they were to put one in there, are they going to have to replace it after 1 year, 2 years, 3 years? You know, how is this going to be something that they can build into their first aid risk assessment?
Sure, yeah. I mean, the typical warranties on the device will change from manufacturer to manufacturer. So the two devices that we've got here are both an 8-year warranty. But we also actually are getting more into the world of lease and finance with this kind of equipment. And so what we're talking to businesses more and more about is building this into from a lease contract point of view, because we're also seeing a demand from the market for service packages. So we've recently launched a product called PlusCare, which kind of feeds into that PUA regulation requirement. And so from businesses' point of view, if they was to take this, for example, on a 3-year lease rather than an outright purchase, it's something that they can maybe review every 3 years in terms of technology. The world that we live in is a very fast-paced world, and technology does improve very quickly. The challenge is sometimes you purchase a piece of equipment that's got an 8-year warranty and you're inclined to keep that device for at least 8 years and possibly longer, and sometimes by then you're actually getting left behind by technology. So by having lease as an option, it kind of really works well for some organisations.
That's brilliant. So you're here, do you know what stand number you're on?
H60, I hope.
H60, so thank you very much to you, Kevin. Thank you very much for talking to us.
You're welcome.
Come to H60 and have a look at their AEDs and how you can build one of those into your first aid risk assessment.